Hello, my name is Cynthia Yamaga and I'm a Pharmacy Product Manager with Medsphere. I have a Doctor of Pharmacy degree and more than 20 years experience in a variety of positions within healthcare IT. Medsphere worked with Silver Hill Hospital, our customer and a nationally recognized psychiatric care facility in New Canaan, Connecticut, to develop a multidisciplinary treatment plan, MDTP, module to meet the needs of Silver Hill clinicians with regard to coordinating care, meeting regulatory requirements, and ensuring the best possible patient outcomes. The collaboration between Medsphere and Silver Hill illustrates the benefits of open source development. With open source, this and other modules will continue to grow and change. Development is an ongoing process. Moving forward, the MDTP module will become a core component in OpenVista CareView, Medsphere's electronic health record, and will be available to all Medsphere's customers as part of our subscription service. No additional fees. I'm going to give you a brief overview of the MDTP module so you can see how it makes a significant positive difference in the provision of behavioral health care. So this is what the MDTP module looks like. As you can see, it's within OpenVista CareView and is just one tab in the EHR. It's a module designed specifically for use on a team environment and gives a concise overview of the patient's issues and how they're being addressed. It is meant to enhance communication and collaboration by focusing all team members on the issue most important to the patient's care. So you can see here that it's only the high-level issues that are active for this patient at this point in time. You can look at the other pieces for other information. So to begin with, this particular patient, for example, has polysubstance abuse. You can see that these are the primary problems or admission problems that this patient came in with. Here are the patient short-term goals, and finally the interventions that will get the patients to their goal. Each of the admission problems, the patient short-term goals, and the interventions has information, as seen on the right side, that you can further drill down into. But the left-hand panel here is meant to focus you on just those high-level issues that can give a holistic view of the patient. Each of these can be sorted if you wish, so the thought is that, for example, the nurse can go into their intervention and be editing their intervention and updating it as the rest of the team does their work. As they update this, for example, they associate this with all these problems, they update it, and it will become updated for the rest of the team. You can edit the plan level to identify the team members, which can change with each meeting if you like, the reassessment frequency, and you can enter comments. The team members that I identified here will get a reminder at the next team meeting, as well as be the team members that are requested to sign the note. So in addition to fostering team collaboration, the MDTP module is meant to meet all regulatory requirements. As an example, when the team signs the note, you can see that as per regulatory requirements, the interventions must have a care action. What is the team member going to do about this particular intervention? And so that is required before the plan is signed. For each admission problem, you can identify the current status. So where this patient is in the continuum, for example, on a 1 to 10 scale. You can also omit the scales if you wish. So as you can see, only active problems will be shown so that you can get a view of what's happening with this patient right now. If you want additional information, you can go to the cover sheet, problem list, labs, medications, etc. to see information specifically about this patient that's not contained in the MDTP. If the patient has a new problem or you'd like to add additional interventions or objectives, you can simply click, and all those problems and objectives, interventions that are associated with this particular diagnosis as defined by your institution will be shown here. As an example, if you would like to say the patient will agree to family meetings within 3 days, you can simply drag them and drop them to the patient's plan. You can edit and you can include defaults for any of these that you wish, or you can leave them blank for the team to fill in. Finally, when you sign this, again, once you fill in all the appropriate information, a note for the patient chart with all pertinent information will be created, and again, all team members that are associated with this planning session will be asked to sign them. As I mentioned, all regulatory requirements will be met by that note. Thank you very much for taking the time to learn more about Medsphere, OpenVista, and MDTP. Please contact Medsphere directly at 877-Medsphere for more information.